Good morning, church. My name is Olayinka Agbola, and this morning I'll be talking to you about a very important subject called hypertension. We'll go through the definition of hypertension as well as, the symptoms or symptom, as well as, possible risk factors, what you should be doing to stay healthy overall. So let's get started. High blood pressure or hypertension is defined as persistently elevated blood pressure above 130/80. And I use the word persistently, or we use the word persistently as a key indicator of defining high blood pressure because we recognize that blood pressure is dynamic, it changes with activity. And if you move about, if you are up and about, the blood pressure is expected to rise to come, also with activity. And when you sleep or when you are asleep, it's expected that the blood pressure should also drop as well with sleeping. Say for instance, you just came out of the shower or you took a cup of coffee, or for those who smoke or drink alcohol as well, you know, there is corresponding, effect also on the blood pressure. So the blood pressure is dynamic. So we often define high blood pressure or hypertension as persistently elevated blood pressure above 130/80. It is very common. It is said that almost about half of adults in America have high blood pressure. And the very interesting or very sad thing is that out of this, half, only about a third are not treated. Only two-thirds are receiving appropriate treatment. So, which means one out of every three of those who have high blood pressure are not even treated for it. And it is a silent killer. We'll get to understand this later on as we go on. But I want to quickly touch on, in terms of semantics terminologies here. High blood pressure, hypertension are the same. I've heard people use the term that, oh, when it gets to a certain threshold, maybe above 160, that's when you use hypertension. No. Hypertension is high blood pressure above 130/80. And, we'll talk about the different stages or the categories of, this blood pressure reading in a moment. So this is a diagram showing the different blood pressure categories, and the normal blood pressure is said to be when that top number is less than 120 and the bottom number is less than 80. And a stage in between normal and high blood pressure is a stage we previously used to call pre-hypertension. In some climes they may not accept that term, but for the purpose of this discussion we use the term pre-hypertension. So the pre-hypertensive stage is when that top number is between 120 to 129. So if your blood pressure is 125, that is pre-hypertension. If it is persistently 125, that's pre-hypertensive stage. And when the top number is above 130, that is when we say this is hypertension or high blood pressure. Okay. High blood pressure also has levels as well. But regardless, if the blood pressure is persistently above 130 and above 80 for the bottom number, it is hypertension. Stage 1 or stage 2 or stage 3 or hypertensive crisis. For the context of this discussion, it may not be relevant, but just bear in mind that if your blood pressure is persistently above 130 or the bottom number is persistently above 80, then that is hypertension. All right, so what are the risk factors? Why do people get hypertension, or how do people get hypertension? In all honesty, we don't know exact reasons why hypertension, develop. But what we have known is that it's a combination, interplay of genetic, environmental, and then some unique biological factors, like individual factors that come together to determine how this blood pressure or hypertension develops. So I will classify the risk factors, that leads to hypertension broadly into two categories. One is non-modifiable. Those factors, there is nothing you can do about them. Once you are born, those factors are there. You can't change them. Why the modifiable factors are those factors that you can, change. And the non-modifiable factors, for instance, genetic, if your parents have high blood pressure, there is a higher chance that you may have high blood pressure as well. Race, African American, Black race is associated with higher, likelihood of developing hypertension. In fact, it is said that the hypertension amongst blacks are more difficult to treat and often result into complications more than the other race groups. So race, you can't change your race. You're a black person, you have a higher likelihood of developing hypertension in your lifetime. And also age as well. As you grow older, the likelihood of developing high blood pressure also increases, for several reasons. Among them is the fact that the blood vessels become stiffer, such that they don't relax as they used to. Imagine, you have a rubber, much when it's just made very easy, you can, pull it apart very easily. But as that, the rubber grows older, the elasticity also decreases as well. In the same vein, the blood vessels, as they grow older, they become stiffer, they don't relax as they should, which also impact the blood pressure. Sex, males, men are generally, they have higher likelihood of developing hypertension compared to, women. The reasons for this, we can discuss it through the entire day. Responsibility, psychological stress, a lot of other things, which, the gender confers on man, and particularly women have the added benefit of the estrogen, which is hormone in a woman that protects them from, the cardiovascular risk factors. But it's said that, when women cross that age of menopause, going into their 60s, that protection again is also left. So, but for the purpose of this discussion, men generally have higher likelihood of developing hypertension compared to women. For the modifiable risk factor, these are the things you can do something about to decrease your chances of having high blood pressure in life. One is obesity. A simple way I look at it is this way. Obesity is excess fat, excess adipose tissue in the body. The way I look at it is that the fat, which is the weight, is resting on the blood vessels such that your heart has to work harder to pump through blood through those blood vessels because the weight of the excess fat on the blood vessel. That's a very layman way of looking at it. But the long and short of this is that obesity is a modifiable risk factor. If you lose weight, you will be amazed at the impact at which your blood pressure would improve. I've seen people who making lifestyle modification, or they went through a obesity surgery and they lost weight significantly. They were taking off blood pressure medication. So that's to tell you how much weight can affect the blood pressure. It's very real. Sedentary lifestyle also tying together as well. Those who sit more generally have the higher likelihood of having hypertension. Smoking, alcohol, I know that's not amongst us, but again, it affects blood pressure. Psychological stress, the cares of life, the cares of this world, life trauma, life events as well can cause high blood pressure. So these are real modifiable factors. These factors, modifiable factors, you can do something about them. You can prevent them. You can reduce your stress level. You can be more active. You can lose weight. Nutrition, I forgot to put that, nutrition as well. You can reduce your salt intake. These are modifiable factors that you can work on to increase or to decrease your chances of having high blood pressure in life. So what are the symptoms of hypertension? if there is anything that you take away from this talk, is the fact that hypertension is a silent killer. It has no symptom. I don't know how else to say this. I've seen it countless number of times. People are waiting to have symptoms of high blood pressure or hypertension before seeking help. High blood pressure has no symptom. I wrote this in capital letters because I want you to get it, and I put it in red because if there is anything you will take away, please never forget hypertension, high blood pressure has no symptom. The moment you are beginning to see a manifestation of high blood pressure clinically, it is late. It is a sign that the body is damaged and maybe too late at that time. So headache is not a symptom of high blood pressure. It is a sign that high blood pressure is doing a damage to the brain. Chest pain is not a symptom of hypertension. It is a sign that high blood pressure is damaging the heart. Okay, so if you say, oh, I don't have a headache, I don't know why these doctors are telling me to take this medication when I feel good. Yes, you are feeling good. You don't want to wait to the point where you are not feeling good before you do something about it. So please know this for a certainty. High blood pressure has no symptom. Please and please, brethren, do not wait till you start having symptoms before seeking help. Okay. All right, so leading us to complications of hypertension. I love this slide and I decided to include an AHA slide. It says hypertension is known as the silent killer, and it is truly a silent killer. High blood pressure typically has no symptoms but can lead to heart attack, stroke, and kidney failure. Just put it this way. High blood pressure affects every part of your body that receives blood. So if you think of any part of your body that doesn't receive blood, maybe that's the only part of the body that is not affected by high blood pressure. But provided it's part of your body and blood supply is getting there, if there is high blood pressure, every single tissue of the body is affected by high blood pressure, provided it's supplied by blood. Okay, so complication can range from, stroke, heart attack, kidney damage, amputation. You'll be surprised, right? Blindness. You'll be surprised, right? Anything can be affected. Any part of the tissue in the body can be affected by high blood pressure. So I put these pictures here just to give us an understanding of how these complications occur. The blood vessels is made up of basically 3 layers. There is a fine, very thin layer, which very delicate, and what it does is to sort of allow for exchange of materials between the blood and the surrounding cells. And this very fine layer, specialized layer, you see it's in a pale pink here. It's very delicate. It's called the endothelium, and it serves as a sieve and also allow for exchange of materials in between the cells. The next layer to it is a muscle, muscular layer, and it gives the artery or the blood vessel, that strength to withstand, pressure. Otherwise, it's just going to burst, right? And then there's a third layer, which is this outer layer, which is like just a sac covering these 2 other layers. And what I'm trying to bring out here is that with high blood pressure, the blood inside the blood vessel, this opening, is traveling at a very high force. Is the force at which it's traveling. So if the blood pressure is high, it means that the blood is traveling inside that blood vessel at a very high, force. and the likelihood of causing a tear, because remember I told you that this inner layer is very thin and is very delicate. The likelihood of causing a tear in that inner layer is high. And what would that tear do? The tear occurs to allows fat cells like cholesterol to bury underneath this thin layer. So that's how fat build up in the walls of blood vessels. Because of that shear or that tear in the inner layer of the blood vessel, fat cells get deposited in that wall. So that's how, you know, fat build up in the wall. I'm sure you have heard about fat building up in the walls of the blood vessel. What usually starts that process is high blood pressure. If there's a natural mechanism that prevents anything from depositing in the wall of the blood vessel, but a break in that normal integrity of the inner vessel or the inner lining of the blood vessel caused by hypertension is usually the first step that leads to eventual fat cells depositing in the wall of the blood vessel. And when fat cells, fat or cholesterol deposit in the wall of the blood vessel, what happens? It builds up gradually such that it narrows, the space that is left for blood to even pass through. So the amount of blood even passing through, even at that high blood pressure, is also is reduced. And remember that, with the accumulation of fat in the wall of the blood vessel as well, the likelihood for that fast blood that is traveling at a very high blood at a high pressure to even damage that obstruction or that the fat in the wall is also there as well. So all of this, which we'll talk about later on as well, leads to the complication. And this third one is that with the blood also traveling, in the blood vessel. Look at this. When you go to the gym to exercise, the more weight that you carry, the more active you are, the bigger your muscles become, right? In the same vein, the more pressure the blood vessels are exposed to, the thicker, the muscle layer in this blood vessel also becomes. So the muscle in that muscular layer becomes thicker such that the effective space that is now left for the blood to pass through within the blood vessel is also reduced as well. So that's another way reason why this complication occurs. And the third one is that the blood vessel, if the blood pressure is too high and the vessels cannot take it, they can rupture and burst, right? So these are possible, complications that could occur from high blood pressure. And it's not only the blood vessels that are affected, also the heart as well. Remember I told you the heart is a pump. Imagine if the heart has to pump at a very high pressure to get blood around. It's like going into the gym every day. The heart muscles, if you look at this left side, the heart muscles become very thick. The first heart on the left side is a normal one, but the second one on this left hand picture is, the a very thick heart because he's been working so hard to overcome pressure for a long time. And when the heart has worked for so long under pressure, it gets to a time where it's just say, okay, I'm tired. And the heart becomes very weak, cannot pump as it should. And we call that heart failure. If you look at this fourth heart on the right side, you see that the walls now become very thin, it gets very big, it becomes flabby, cannot pump blood as it should. That's called heart failure. So those are some of the complications that could occur from high blood pressure. Moving on, next is how do we measure blood pressure? This is very, very important. I want us to watch this video. And Right, very good. So that's a very good video on how to check your blood pressure, because what you don't know, you can't care for. If you don't check your blood pressure, it's like just shooting in the dark. It's like just walking in the dark, right? You don't know what exactly, the numbers are. So I wanted us to look at, the interpretation of the numbers when you check the blood pressure. This is just a picture I got online that's showing these numbers. Most blood pressure monitors will display three numbers. The first two numbers are your blood pressure, and the bottom number is usually your pulse rate, the number of times the heart is pumping per minute, every 60 seconds per minute. Okay. The first number usually is a systolic number. That is the force at which the blood is traveling, within the blood vessel. The second number is a diastolic number. Is somewhat a measure of blood pressure, is looking at how well the blood vessels are relaxing, after blood passes through them. It is said that for most people above the age of 50, the top number is usually the more important number that has important implications for heart disease, of causing heart disease. And the reason is because, when you are older, 60s, 50s, 60s, and above, the blood vessels are naturally stiffer. So the diastolic blood pressure, which is the bottom number, usually we don't really rely on them at that time, because we know that this is a natural progression for the for this person, because they are much older. So the top number is usually the number that we are very, very concerned about, and we want to make sure it's not too high. Yes, I wanted to talk about this, the importance of measuring the blood pressure. I took this picture from Amazon, and the point I'm trying to get across here is that the cost of having a blood pressure machine is negligible. $28, 35, 19, $34. So this nobody has an excuse in America at this time not to own one of these devices. Go to Walmart, go to Target. You can always CVS. You can pick any of these devices. Order from Amazon and have them. It is, if you are above 40, you cannot claim ignorance not to check your blood pressure. Please, I beg you, get a blood pressure cuff. There is no one that should be above 40 without a blood pressure cuff at home. And you check. The question is, when do I check? Is it morning or evening? The usual advice I love to give is first thing when you wake up, last thing before you go to bed. But keep the timing relatively consistent so that you can compare it. And when you check your blood pressure, don't just look at the numbers on the screen. Write them down. Have a log for it. And that's the way you can spot trends over time. If the blood pressure is increasing or is decreasing, you can all easily spot trends when you write it down instead of just eyeballing it on the screen. Okay. So we'll look at prevention and control. So what should I do to prevent and to control hypertension? The first thing I would say is know your numbers and check regularly. If you don't know, you cannot intervene. You don't know what to do. So it is important that you have a blood pressure cuff at home and check regularly. If you are taking blood pressure medication, I would advise that you check 2 to 3 times every week, if not every day. In fact, if you're taking blood pressure medication, I would recommend that you check it every day, because sometimes you may need to adjust the dose of the medication based on your physician's recommendation. So check every day and maintain a log. And then you check regularly. Second thing is maintain healthy weight. Maintain healthy weight. We've talked about the impact of obesity on blood pressure, so you want to maintain a healthy weight. Be active. If you sit around, your blood pressure, you're gonna get weight, get obese, or you're gonna get fat. Let me use that word. And also, activity as well. Blood pressure improves with exercise. So if you exercise well, the blood pressure also improves. The amount of medication you will need to control the blood pressure also decreases as well, because one, you're going to lose weight. Two, the impact of exercise on the blood vessels as well also decreases blood pressure. Then reduce salt intake. Salt, from Maggi and all the condiments we put in the food, these are all salty. So you want to limit salt intake to less than 2 grams every day, in a day I should say. And look at the labels of your food and make sure that you don't have too much salt in the food. Okay. And then psychological stress, particularly for men and women alike as well. Take life easy, have faith and trust in God. uh, if you are too bogged down by the events of life, it affects the blood pressure. And honestly, life continues, so you don't want to be caught on the side of being bogged down by all the cares of this world. You're pulling too many shifts, you don't even have time to rest. You sleep a few hours, and you have issues of life that are unresolved. Cast your cares on Jesus, he says. And it's much better than carrying it on ourselves, because it impacts the blood pressure as well. And take your medication. Faith and medicine, they work together, they don't work against each other. Have faith, that's very good, but take your medications. While you are building your faith, it's important that you take your medications. And even taking medication does not mean you are faithless. It does not mean that you're a sinner. No. Take your medication. And it's important as well that you follow up. Some people, oh, I have my medication, I'm taking my medication, I don't need to see a physician. There are tests that need to be done from time to time to assess your organs. There are tests that need to be done to assess the impact of this medication on your electrolytes. There are tests that need to be done to assess, how your heart is functioning. So don't just assume, oh, I take my medication. The last time I saw a doctor was 2 years ago, and oh, I take my medication regularly. No, that is not right. So you have to follow up with your doctor from time to time as well. Sorry, I think that's. So I want us to watch this video, which I think it paints a very graphic picture, but I think it will be helpful in driving home the message this morning. right? So that video is very touching, but it drives home the message. You have to take care of it. You have just one life to live. You have just one body. This is what qualifies you for life. So you got to take care of your body. Okay.